And namaste everyone. Today I will speak to you about stroke. I would like to give you some salient points and tips regarding stroke. Now, stroke is a very common symptom which all of us would have encountered. So, all of us know that stroke is something to do with the brain, but generally there is only a vague idea regarding stroke. So, what is stroke? Stroke is nothing but there is a sudden vascular abnormality involving either a portion of the brain or the whole of the brain, which causes dysfunction in the brain. So, normally what is understood as stroke means when one side is paralyzed, for example, left is paralyzed, and the patient's face becomes like this or like this, or patient becomes unconscious. This is the usual belief about stroke, and to a large extent it is true also. Basically, it means there is some sudden alteration in the blood supply going to the brain, and that results in dysfunction of the brain. It can be global or it can be local. That means the portion of the brain is involved. Now, each portion of the brain has a specific function. For example, if there is a speech area alone is involved, a patient would be having difficulty in speaking alone. Or if the patient is having some problem, some area of the brain which is involving the arm alone, so only the arm will not be able to move. So things like that. Sometimes the whole brain may be affected acutely and that patient will suddenly go into coma. So this is what a stroke is. And broadly speaking, stroke is divided into two types. One is due to either obstruction, that is the blood is not going, suddenly blood gets obstructed. We'll come into the causes later, or sometimes what will happen, the whole blood vessel may burst inside the brain. So these are the two broad categories. So the reasons are different, and obviously the treatment also will differ based on what it is. So initially stroke was seen for many years as nothing can be done once brain is damaged. No. Things have changed a lot, especially in the last 25 years. Now there are very good medicines, especially when there is a block. We can remove the block immediately, most often by giving a drip through the hand, or sometimes like they do the catheter angiography, put a wire inside and then it can be removed. So things have changed. What it means is we need to identify fast and treat fast. So that is very important. So before going into that, now the types of stroke, I said one is due to block, that is called ischemic stroke. Here, what are the reasons? The usual reasons, usual culprits as usual are diabetes, hypertension, high cholesterol, smoking, pre-existing heart disease, sedentary lifestyle can predispose to this, and sometimes any other, what is called a rheumatic heart disease, that is when the children develop heart disease in young due to some infection, or they can be due to heart rate variation. These are the usual risk factors. So let us remember broadly that lifestyle changes, smoking, diabetes, hypertension, cholesterol. These are the ones which have to be controlled mainly to prevent the stroke. Now when it comes to rupture of the blood, there are broadly three. One is due to high blood pressure. Second is there is a problem in the development in the blood vessels of the brain, meaning thereby that blood vessel normally will be like a pipe. In one area, it could be like a balloon from birth, and due to some reason, it ruptures. This is the second reason. And the third reason is that the veins, which are more fragile than the arteries, those get obstructed and they block. So we will not go into those things later. So remember, ischemic and hemorrhagic. Now let's go to ischemic. So I have told you the risk factors. Now how to recognize. There is an acronym called BEFAST. B stands for balance, that means any problem with the balance. I stands for any eye changes, that means vision problem or double vision, which has to be sudden onset. Fast is the face, any drooping of the face. Then A is arm, that is limb weakness, arm weakness or limb weakness. And S, which is speech, abnormality in the speech. Last T refers to time, that means time is very important. So we have to rush these patients very fast to the hospital. Because once there is a block, every minute, every hour, millions and millions of neurons are lost. So if we do intervention early, there are medicines now, powerful medicines now, which can open up the blood vessels, and once that is injected, many patients do recover almost completely. So it is very important to reach the hospital fast. In the hospitals where usually these are routinely done, and treatment also has to be initiated fast. So there are three things. One, the recognition and transport of the patient to the respective hospitals. Second, diagnosis of the thing very fast in the hospital. Third, immediate administration of the medicine has to be done. So another crucial thing is, so we need a lot of awareness in this at the level of the public, at the level of the hospital staff, at the level of the administration. So a lot of things has to be done, and this is not a one-man job. So everyone has to work together to make this happen. Nowadays, more and more people are benefited by this medicine, and many of them do well. Sometimes this medicine alone may not be enough, and sometimes we'll have to inject, go inside and mechanically remove. Even then, if it is done early and properly with proper indication, they definitely do well. So, and another important aspect is always they say prevention is better than cure. So, prevention is very, very important. So, how do we prevent this? So, first is diabetes. Anyone who's more than 35, please check your blood sugars at least once a year. Have a healthy habit. Have adequate protein. Even if it is vegetarian, there are a lot of protein sources for vegetarians. Lot of protein. Carbohydrate should be cut down. And exercise. 30 minutes of brisk walking per day and some isometric exercise. Then if the patient has blood pressure, target BP has to be 130, 80 and below. Again, reduction of salt. Another misnomer which many people have misconception is the moment they are diagnosed with hypertension, they totally cut off the salt. That should not be done. So extra salt should be cut. And then of course exercise, walking, and then stop smoking. And stress is another important factor. See, stress is going to be there wherever we go, whatever job we do. This has become very common now. It is for us to mount an adequate healthy response to any situation that will reduce the stress hormones. So this is also very, very important. And these are the ways to prevent the strokes. And of course, when it comes to hemorrhagic stroke, it is important to make sure that the BP is maintained under control. And so the take-home messages are, what are the take-home messages? Stroke is very common. It has to be recognized very early and treated appropriately, because once there is a large stroke and we lose the time window, patient is significantly disabled. Unlike other diseases where the patient can take care of himself or herself, if a patient develops a stroke, unfortunately he or she will be bedridden for a long time, and the whole family dynamics, equation, everything is affected. They need help from all sides, from within the family, from outside the family, from the society. A lot of help is needed. So a lot of things can be mitigated if we recognize this early, treat early and prevent early. So this is number one. Third thing is time. Time is very, very important. First 4.5 hours are crucial. So if we can identify and treat the stroke within first 4.5 hours, many people do extremely well. In fact, many people who come with zero power can be reversed almost completely. So these are the things which needs to be kept in mind, and of course healthy diet and exercise. This is an introduction regarding stroke. Main idea is to bring in awareness and to say that stroke can be easily recognized and treated. One last point, there is something called transient ischemic attack. That means the patient would develop stroke-like symptoms for a few minutes and then recover. These are the people who should be aggressively treated, because these are warning signs. They should not be ignored. That means if anybody has a loss of balance for a few minutes, or difficulty in speaking for a few minutes, or can't lift their arm for a few minutes, or seeing double for a few minutes, they have to be treated early, because they have to be recognized and to prevent the major stroke. So BEFAST is the acronym we all should remember. Stroke, yes, is very much preventable, very much treatable. Things are totally different now. So let's hope we all practice and spread this message. Thank you.